topic is watery tuberculosis. It is also known as TVC, which is tuberculosis varicose cutis. The other name for this is anatomist wart, or you can say prosector's wart, or the third name is varicosa necrogenica or verrucous necrogenica. Now, very important thing is it always occur by the exogenous route. So something is coming outside of the uh, outside exposure in the wound. So any abrasion or injury is very important for this to occur. Now the second important thing is about the person. That person is always sensitized to the TB. Therefore, the person is sensitized, the immunity will be high. So very few bacteria will be able to pop this or injury. So it will always be possibacillary. It occurs in a wart-like extension. So on histopathology, you will find papillomatous growth, papillomatous hyperplasia. In the superficial, you will find abscess, dermis, and deeper you will find granulomas. These granulomas may be caseating, and very few bacilli can be found in these granulomas, and mixed infiltrate will be present. Now the second thing is it's very slow to occur, progression, and very slow to heal in years and months. But healing always occurs with atrophic scarring. Now important thing is variants of TVC. For variants, remember the lesion. First of all, at the surface there is sclerotic changes. Then deeper growth, destructive, deeply destructive papillomatous form. The third thing is exuberant granulomatous, tumor-like, then hematogenous, or you can say generalized. These are the 5 variants. You can remember it by this silly diagram. So for the investigations, IGRA is very important because IGRA can differentiate it from the atypical mycobacteria or BCG vaccination that is not affected by this test. And the treatment is ATD. So this is all about watery tuberculosis. Is about junctional EB. For junctional EB, the two important things is that it's autosomal recessive and the split is at the level of lamina lucida. Now there are different types of generalized EB, broadly dividing into generalized and localized. Generalized is further divided into severe, intermediate, late onset, then pyloric atresia, then with respiratory and renal insufficiency. For localized, there are 2 different variants. One is inversa, and the second is laryngo-onychocutaneous syndrome, which is also known as Shabir syndrome. The main pathology in all these things is laminin 332 and type 17 collagen. Just for pyloric atresia, it's alpha 6 beta 4 integrins. And for this very specific respiratory and renal insufficiency, this is alpha 3 integrin. So these are the basic proteins which are deficient in this disorder. Now, whenever junctional EB is in your differentials, the main clue for the diagnosis is 3 things. One is the generalized blistering history from birth onset, and there is exuberant granulation tissue. Second thing is dental anomalies, which can be in the form of dental enamel pits, in the form of dental malformation, or the premature shed. Third is the nail dystrophy. Nail are dystrophic and sometimes they shed prematurely, and there is bulbous deformities of the fingers. So these are the typical features of the junctional EB. In severe junctional EB, these will be more severe, They rarely survive beyond infancy, while in intermediate, these will be less severe. More or less, features are the same, but the severity is different. An additional clue for the intermediate form is hair changes. Hair is abnormal, alopecia can be formed, or the thinning of the hairs can be formed in the eyebrows, eyelashes, and scalp also. The second important clue for the intermediate EB is there is revertant mosaicism. That some areas of the skin will be free of blisters, and in pale individual there may be hyperpigmentation in that areas. So this is the overview of the junctional. Third topic is EDV, or epidermal dysplasia verruciformis. Three things about this is plain warts, SK-like lesions, and the third thing is P versicular-like lesions. Two genes, EVER1 and EVER2. One important thing is sun exposure. Photosensitivity is positive in these patients, and the role is human papilloma virus. There are many species of the human papilloma virus starting from 5, 8, 9, 12, 14, 15, 19 to 25, many more. But the main thing to remember is 5 and 8 are associated with malignancies. And malignancy is your SCC. For the treatment of epidermal dysplasia verruciformis, because the sunlight has the role in it, so sun protection most important. Other treatment starting from topical is the option imicumod, photodynamic therapy, cryotherapy. Then comes topical vitamin D or topical immunotherapy in the form of squaric acid dibutyl esters, oral cimetidine, oral zinc. The most important treatment, which is systemic treatment, is acitretin. That also prevents the progression into the squamous cell carcinoma. Now comes the scheme to examine the patient of the EDV. Because whenever you find the command to examine the hands, okay, to start with the hands, ignore the diagram. Start with the dorsal surface, examine whole of the dorsal surface, then examine the finger web spaces, nail of the patient, compare it with the opposite hand, then look for the palmar surface, all of the palmar creases, compare it with the opposite hand, then go for the feet examination, similar nail examination, web spaces, palmar surface, dorsal surface, sole of the foot, compare with opposite side. Then because it has relation with photosensitivity, you have to examine the face also, and along with face, look for pallor, jaundice, lymph nodes, your thyroid examination, and because photosensitivity also include your scalp area, so scalp examination, and at the end, because the warts are the association, so axilla and groin. So these are the relevant examination for these patients. And P versicular like lesions can be found on the trunk, so cutaneous as a whole, dorsal surface, palmar surface, dorsal surface of feet, soles, face, scalp, axilla, groin, and whole of the trunk. When talking about the face, you have to cover the 10 points of the face: 2 eyes, 1 nose, 2 ears, 1 scalp, cheek examination, your thyroid examination, and lymph node examination. So you have to cover all these areas, that includes your face. Also the oral cavity of this patient, that is making the 10 points.